All right, I'm going to be assessing the respiratory system. And what I'm going to start with is inspecting the chest, looking for abnormal breath sounds, barrel chest, use of accessory muscles coming out, or any intercostal muscle being used. Next, I'm going to palpate the chest area, touching and checking, looking for air trapping. All right. Next, I'm going to be checking for tactile fremitus. And what I'm going to do is every time I push in, it will say 99. Okay? So what I am doing is going in between the intercostal muscles, and I'm
99, 99, 99, 99.
all right. And what this is doing is checking for symmetry in the vibrations, and you will repeat that on this side as well.
99, 99, 99, 99, 99.
Okay. Next, I will check for the anterior wall chest expansion. I will come here, grab it. No, you will breathe in, take a deep breath in, and out. In, and out. What you will see is that while my hands were pinched in, come closer, my hands were pinched in as he breathed in, and out. We're looking that it didn't rise one before the other, and it didn't release one before the other, looking for the symmetry in the lung expansion. This will also be tested in the back as well. Next, I will also take for lung sounds. And you will notice I will start in a pattern from left to right while I listen. Okay? I'm going to ask you to just take deep breaths in and out. Okay?
Okay.
And we will start above the clavicular line. And we will listen. And we'll listen. And we'll start the second intercostal space. And out. In and out. And as I listen laterally to the right lower lobe, and I will listen to the left lower lobe. Alright. Now, if this was a female and it were larger breasts, to make it easier, I would have just asked her to lift her breast. So that way it would take away the discomfort or anxiety, I guess, from the examination. Now we will percuss, listening for any lung sounds. The lung is filled with air, so we will have some resonant sound. What we don't want are the dull sounds. And when we percuss, we will percuss from left to right in the same area. Now I am going to start on the posterior back for examination, and I'm going to inspect again. I'm looking for any abnormalities, any no symmetries in an area. I will also be checking for effort of breathing as well. Then we will palpate, checking for tenderness and pain in the back. And then I will also do tactile fremitus here. I will press in using palmar aspect of my hand, and I will try and not be a scalp and say 99.
99. 99. 99.
And what I'm looking for is the
99.
vibrations.
99. 99.
I will also check lung expansions in the back. We'll cup up under the ribs and bring a little indentation here. I'll ask you to take a deep breath and release. In again and out. Alright, what you would notice is that it lifts all at once and release all at once. There's no one moving higher or lower than the other. So this is a normal finding. Now we will be auscultating for breath sounds in the posterior chest wall. Excuse me. You take deep breaths. Okay. If there were any breath sounds, you would hear wheezing, crackles, stridor, bronchi. These would all be adventitious breath sounds heard. And we will percuss the back lung fields as well. We actually do not want to hit the scapula. The scapula is a bone and will automatically give us a dull sound. Remember, the lungs is filled with air, and we do expect the resonant sound to come. Excuse me. Now, there are a couple of special tests that can be done, and what we're looking for, testing for, is consolidation in the lungs. One of the first tests we're going to do is that we're going to do the bronchophony test. This is going to check for consolidation in the lungs. What I'm going to ask you to do is I'm going to ask you to say 99 while I listen to the lungs. Okay? And what I want as a normal finding is that it's going to be a very dull sound, very distant, muffled sound. And that is a normal finding. But if I can hear him say 99 very clearly, what's happening is that sound can travel very good over fluid or water. So that means there is some type of consolidation found in the lungs. All right, I'm going to press over with my stethoscope and you say 99.
99. 99. 99. 99.
All right. Now we can do the same test, and this one would be called whispering ventriloquy. Pictoriloquy. And what we are doing is you're going to whisper the numbers 1, 2, 3, 1, 2, 3, but you will whisper them. And again, we are checking for consolidations in the lungs. Now, a normal finding is that it should be distant, muffled, and barely heard. I should know he's saying it by looking at it, but I shouldn't be able to hear it through the stethoscope. And if I am, there is an indicative of there is some type of consolidation in the lungs. I do thank you. This wraps up my respiratory assessment.